This is Dr. Vinay Samuel Gaikwad, Director of Surgical Oncology at Birla Hospital in Gurgaon. This video I want to talk about the treatment of rectal cancer. Now this is a very vast topic, but in a nutshell, what we want to discuss is what is the main treatment strategy for these patients. So the nutshell answer to that would be surgery. Surgery remains the main treatment option for localized tumors of the rectum or localized cancers of the rectum. The cancer can be in the upper, middle or lower rectum. Based on this, many decisions are made by the clinician. But basically, if the tumor is diagnosed because of symptoms such as bleeding or altered bowel habits, usually it is a more advanced stage and we do not go for upfront surgery. We offer what is called neoadjuvant or treatment before the surgery is done in the form of chemoradiation and sometimes both chemotherapy as well as chemoradiation. This shrinks down the tumor and therefore prevents or decreases the chance of the disease relapsing or recurring back into that same area in the rectum. So after this neoadjuvant treatment is done, we plan for surgery to remove that part of the rectum with negative margins. So the margins could be at least 2 centimeters beyond where the tumor is ending and at least 5 centimeters before where the tumor is starting. And the circumferential margins or the margins on all the sides of the tumor are also important to make sure they're negative. So during this operation that is done either through minimally invasive techniques or through conventional open technique, we ensure during the operation that these margins are negative through what is called a frozen section examination, which is done in about 15 minutes. So once we confirm that these margins are negative, we then re-establish the continuity of the rectum through an anastomosis. And if it is a mid or low rectal tumor, we make a covering stoma just to ensure that a leakage does not cause any problem to the patient in terms of sepsis or other complications. So nowadays, most of these surgeries are done robotically. We use the robot because we can preserve the nerves better. We can have higher chances of saving the rectal passage with superior functional outcomes. That means better control on the passage of stool as well as fetus in the long term. So after this is done, and if any further treatment is required, such as chemotherapy, that is delivered to the patient, and then finally the stoma is closed. So in a nutshell, this is a multidisciplinary approach that is taken for a patient with rectal cancer, but the foundation for adenocarcinomas which are localized is still surgical treatment. I hope this has been to the point and well understood.